So my name's Jen. I'm from CCLC, and I'm the capacity building specialist there. So I'm really happy to be here today to talk about the Yazidi Refugee Mental Health Peer Support Program. So this was recently funded by the London Community Foundation's Community Vitality Grant, and is a partnership with Marymount Family Support and Crisis Centre, Canadian Mental Health Association Middlesex, and Mary J. Wright Research and Education Centre at Western University. So the purpose is to develop, implement, and evaluate a tailored and culturally integrated mental health peer support program for Yazidi refugees in London over the next 2 years. So why mental health? Why Yazidi? And why use a peer model? So we know refugees are at a substantially higher risk for mental health issues and are less likely compared to their Canadian-born counterparts to seek out or be referred to mental health services, even when they experience comparable levels of distress. We know there are many reasons for this. For example, mental health being a taboo issue, cultural beliefs around mental health, distrust, lack of information about available services and supports, and cultural and language barriers. In 2017, Canada resettled Yazidis from within and outside Iraq with a special focus on vulnerable women and girls. The Yazidis are an ethnically Kurdish and a minority religious group primarily based in northern Iraq that have gone through over 74 reported genocides in 800 years, with a population estimated around 800,000 to 1 million people. In 2014, ISIS committed multiple crimes against humanity, war crimes, and genocide against the Yazidi people, resulting in extreme exposure to sexual violence and enslavement, mass killings and abductions, forced separation of family members, forced conversions and indoctrination, experiences of child soldiers, and forced migration. The community was resettled primarily into 4 destinations in Canada: Calgary, Winnipeg, Toronto, and London, giving small pre-existing communities. Locally, about 400 Yazidis have been resettled into London, and is the largest Yazidi community in Canada, with 79% under the age of 30, representing a unique opportunity to support a young, growing, and vibrant community. The Yazidis are courageous, and they're resilient, and they're making incredible strides. However, given the levels of pervasive violence, individual, collective, and transgenerational trauma, and resettlement challenges, their integration has been complicated and complex. And it's highlighted as a community the need to do things differently to support the healing and recovery process. There's also strong evidence and research around peer-based models, emphasizing the value and impact of sharing one's lived experiences and refugee health recommendations. For example, our program aligns with mental health recommendations on scoring aspects, for example, of drawing on recovery approaches, fostering resilience, working across sectors to develop comprehensive, coordinated, and accessible services and supports, listening to people who have gone through or undergone refugee experiences, improving access to information on available mental health services, and using culturally appropriate approaches. Our hope through a robust evaluation process and community stewardship of this project is to be able to disseminate findings and for this to be scalable for other communities and refugee populations in the future. Our program will empower the community by creating leadership and economic opportunities, implementing support activities, and creating a sense of belonging by connecting to services and support. It will improve the wellness of the Yazidi community by forming more formalized peer networks and training peers to provide support from within the community. All complex problems require innovative solutions and multiple perspectives to collectively address emerging and growing challenges within our community. So this is our opportunity to do so. Canning has a long-standing, progressive, and humanitarian commitment to refugee resettlement, and both locally and nationally, immigration is growing. Thus, developing and evaluating culturally integrated programs that support refugee mental health is something that will be increasingly vital for years to come. When refugees arrive, they are newcomers, but more specifically, they are Londoners. Thus, it is our job to understand and respond to their unique needs and support their meaningful participation in our neighborhoods and communities. We have a lot to learn about the resiliency and the tenacity of new refugee communities, like the Yazidis, and what role we play in supporting their healing process. Thank you.